we should look at more comprehensive data, because that just indicates how many people are coming from Southeast Denver to go to those locations.
Okay.
And we're going to see that where outliers
Sure.
in Denver, it seems like there's not a lot of testing done, but they could be going to many other places. But I will take a look at that for you.
Yeah, if you could get us a map. I think what would be great is if we could get a list by district.
I think it'd be great.
Some districts probably have more than others. Some may have none. That would be really helpful, Bob. And
Talk
again,
about COVID testing right
very
now.
much for what you're doing. And I would just echo what my colleague, Councilwoman Knight, said as far as what you know and we all know, the need for 7-day-a-week testing is getting more and more critical. Thank you. Appreciate it. Thanks, Madam President.
DPS is back to online learning. Y'all behind.
Thank you, Madam President. And Director McDonald, thank you for all you do. I want to thank you for your data-driven approach to COVID policies. And,
I appreciate you being a nice guy, Chris. I do. But you need to hammer their asses too.
Helps us be more determinate as a city and state.
I know you use your voice differently than I do, but you are a white man and you can go a hell of a lot harder than I ever could and be catered to.
I also want to thank you for your willingness. In your presentation, you mentioned having some judicial enforcement to ensure compliance. I want to thank you for that too. I think that with something as important as people's lives at stake, we need some carrot, we need some stick. So, certainly judicial use of the stick is, we want to make sure that people realize that there are all sorts of reasons why it's the right thing to do. So thank you for that too. We heard from a large business yesterday who said that they believe that they have been good stewards and are frustrated that they have been an exceptional partner and feel like they should be an exception to our new level 3 policies. I don't want to name it's a venue that we all know, but rather than talk about one specific venue, perhaps you could address.
I'd love to hear the specific venue. So with the Denver Protest Twitter. Which specific venue?
Who feels that that business should be different than all the other businesses in that category?
Yeah, it's hard to speak to that because I don't know what the arguments would be for that. Certainly, we want to be consistent and
try Jesus.
But
don't try me.
Say that this is really important to understand that even with 100% compliance, if we had 100% compliance in level 2, that doesn't mean it might be enough to control the virus with what we're seeing. I've never in my history of 30 years in public health, I don't know if I've seen a pathogen, whether it's a parasite or bacteria or a virus, spread quite as easily as this does. And as I said earlier, respiratory viruses tend to do better in colder climates. My sense is that that's contributing to some of this. And then again, our bodies respond differently to pathogens and we're more susceptible in the winter as well. So even at 100% compliance, while I have a lot of empathy for businesses that have done everything that they can and compliance is at a very high level across all sectors, but that in itself doesn't mean that we don't need to do more. It's unfortunate, and I hate to go there, but that is the reality with this, that even the best run facilities, sometimes we need to tighten up a little bit more. We're going to continue to do everything we can to avoid that and just to control this virus. But anyone who feels like any business sector, any type of business or individual that wants to talk about what else can we do, or I think this is unfair, or I would just encourage them to reach out to me so that I can speak more in a more targeted way to their concern. But I think it's important, again, not to belabor the point, but even with 100% compliance, there may be times as we go through the course of this pandemic where we need to tighten up, even if everyone is in compliance.
Great, thank you. I noticed you haven't put any restrictions in place for COVID. Can we target COVID specifically and put restrictions so that it will come into compliance? And I'm just kidding.
Okay, okay, I'm sorry. I was trying to track you there, Councilman, but
No. I mean, like, why don't we just make the virus illegal? Then it won't come into Denver, right? So what about gyms? Interestingly, that particular vertical, we've gotten more outreach from that vertical than from any other. That in this level 3, I think gyms are closed entirely, indoor gyms. And what's the rationale behind closing them entirely?
well, I believe the state made an exception to that, Councilman. When they rolled out the information in terms of moving Denver to level 3, they hadn't quite settled in on what they wanted to do with those types of venues with gyms. And so they are not closed at this time. I believe the allowance is 25% capacity with the other restrictions that should be in place with distancing and face coverings and that sort of thing. I know in the dial it might suggest, I don't have the state's dial in front of me, but I believe the dial might suggest that they're closed, but they made an exception for that. And so that's coming from the state. And every step of the way, though, and I'm very confident that the state is doing this, looking at data, looking at where outbreaks are coming from, even if you were to set the data aside, just where are we seeing outbreaks, where are we seeing non-compliance, all of those things should be rolled up in the decision-making process in terms of next steps. And so my sense is that they probably looked at that and incorporated that into their decision-making in terms of what to do with gyms.
Yeah, thank you. Again, compliments on the data-driven approach at all levels, local, state, and federal. Hopefully we get a little better data-driven approaches at the federal level too. But yeah, and thanks also for the information about gyms. I didn't realize that there was a correction. So good information. Is the city tracking how sweeps of homeless encampments are impacting the spread of COVID among that population, and how that affects the whole city? Yeah.
Well, Councilman, with all due respect, I every time I hear the term sweeps, I cringe a little bit because it implies that maybe that we're taking action for reasons other than perhaps the area needs to be clean, really, or there's some serious public health risks there. But I appreciate that that's a common term that's used. We have very early on when testing was done in encampments, and we still do testing of shelters. While we're seeing a slight uptick there, it's still relatively low compared to what we see in the community. In terms of your question about where are you tracking how many people might be exposed because they had moved from an encampment to a shelter, that's a very difficult thing to track that. And frankly, it's difficult to track.
It's difficult to track the unhoused, really?
They've been to a restaurant, they can say they've been on mass transit, and a lot of people check the box on all of those things, but that doesn't mean that that's where they got it from. It means that they've been doing those things, and it could have come from one of those sites. So it's a really hard thing to do. What I can tell you is that, we're
getting people to give a flip about the unhoused is really hard. Did you know that?
And I'm just speaking solely for this department. Just stepping in on encampment issues when it truly is a public health risk, and we need to get them into a better situation there.
Yeah, we do.
But
we do.
There's been a lot of questions about
correct.
CDC recommending that local departments of public health don't move encampments. But again, I've mentioned this many times. We've spoken directly with the CDC and have correspondence from them that says, we understand that there are, that it's balancing public health risk. And so every step of the way, we're going to continue to monitor how many cases we're seeing in
Moms,
shelters,
get in this
what
meeting
types of
right now,
viruses
please.
or
I'm
other
live
types of
streaming it. They're
pathogens
talking
that
about
we're
the
seeing
unhoused and how it's bad for
encampments might be
restaurants.
conducive to spreading. And we're going to continue to do what we believe is the right balance there. If you'd like, I can try to look at more
stop the
specific numbers
sweeps
about where we're seeing, what we're seeing in terms of positive cases and sheltering. So I can send that on if that's something you'd like to look at.
And thank you. And I was actually reading the question verbatim from a constituent. So this constituent used the word sweep. So I understand that even that word is a controversial term. So I wasn't trying to create controversy. I was just trying to make sure that I captured what my constituent was asking. And maybe just as a thought, I don't know. You're right. It is difficult to know exactly where COVID comes from. We have correlated increased crime statistics around encampments, and I don't know if that is a way. I don't know if that's possible to do from a COVID perspective of like increased infections based on. But I know that when
this
I went
right,
to
public health
center a couple times,
requires
they asked for my address, and
containment
I'm
or
assuming that's how you
control.
got some of the demographic data that you had in slides earlier today. So I don't know if the folks who are in encampments, if they give a street corner or what, but I'm just throwing that out there. So maybe that's not possible, but if it is, that'd be great.
Well, I'm certainly committed to taking a look at that. Again, very hard to track where people get it from, regardless of what their situation is. I'm not a master of the housing discipline, but I certainly work with my colleague, Britta Fisher. Perhaps we can work together and with some of my staff to see if we can track that as best we can. And if we can identify some things that we think are meaningful, we'll certainly go ahead and share that with everyone on council.
All right, thank you. I don't have any other questions. I do want to make a similar ask that Councilmember Kenich's ask. Would you please work with finance to get a comprehensive citywide look at the cost of our homeless enforcement actions? And that actually was my phrasing.
Yep.
Housing and homelessness
Cost of
is the
sweeps.
most important issue we receive in our office, and it's important that we understand how we're responding to these issues from all angles. The financial data can be used to make good cases for other solutions like safe open spaces, and frankly, money is a language our business community understands as well. So understanding the money side helps us with budgeting. It helps us with communicating to the business community. It helps us understand.
You're a born politician, Chris Hines. Get him.
So thank you, Madam President.
I'm happy to do that. If I could just ask for a little clarity there, Councilman.
Clarity?
I understand you had asked.
I got clarity.
How much money is spent towards homeless enforcement. I want to make sure.
Homeless enforcement? Is that a thing?
I mean, the city devotes a lot of resources
to sweeps.
And I'm often, well, not often, but sometimes I'm asked, how much money does DDPHE devote towards addressing encampments or towards addressing homelessness or what have you? And our actions on encampments, when they rise to the point where it's a serious public health risk, the resources that we devote to that pale in comparison to the resources that we devote to those experiencing homelessness in terms of responding to the concerns they have, inspecting shelters to make sure that they're safe. So
who is this guy? I want to be his friend now.
Are you asking for resources devoted towards just enforcement, or resources more broadly devoted to addressing homelessness, because that figure is much larger?
Yeah, thank you. And thank you, Madam President, for your indulgence. Absolutely valid clarification. I think that we as a city could probably have a better dashboard for but
if we become friends with him,
like city council authorizes,
we can squeeze it out without him noticing.
We authorize millions of dollars every week about homelessness. From the top line, just the raw dollars, I think we could get better at
oh my God, this is where we are in the morning, y'all. He said raw dollars and I heard raw dogging.
Specifically on enforcement actions, I think that's important too, because it's a very controversial topic. And
yes, it is.
As an example,
because we're reinforcing
another topic that is
enforcing
consideration is safe open spaces, and there's resistance to it. But if we can say a safe open space costs X dollars, an enforcement action costs Y dollars is greater than X dollars, it just makes sense, and so then we have a potential justification or another arrow in the quiver, explaining why alternatives makes sense. And then we, with a safe open space, then we can put services there, we can put sanitation there, we can, instead of, and I would say it's better for the adjacent neighbors and homes too, because then, people aren't using their garden hose, or they're not, urinating or defecating in their lawn or whatever. So, I mean, I'm trying to come up with as many not justifications, but explanations as to why this is an important, option. Why we should have more options than just having people live in tents in our right of way.
Understood. Thank you.
Thank you, Madam President.
Thank you, Councilman. Councilwoman Sandoval.
Good job, Chris Hines.
Thank you, Madam President. Hi, Bob. So thank you for, in your comments, thank you for referring to people in households. I think I've mentioned that to you several times about the need to make sure we talk about households, not families, because in the Latino communities and other communities that say families, you're like,
Was
oh
that
yeah, we're all
strategic
family.
Spanglish? I heard. Where's Carrie Joy?
You have to be in households. So thank you for referring to that, and the communication that you push out as much as possible. You can make sure to distinguish between households and families. That would be really helpful in my neck of the woods. So I was looking at your slide for the state dial, and I understand where we are now. And what I keep getting questions on in my office are what would lead us to a stay-at-home order. So what triggers is the state looking at? Are they looking at hospitalizations? Are they looking at
Good question. What is the state
positive
looking at?
COVID cases? Is it a mixture of two? Is there a metric that you could talk to us about what would lead to a stay-at-home order? Does that make sense?
Yeah, absolutely. And so, it's primarily the three metrics that you see on the dial, whether it's on my slide or whether you visit the state's website. It's cases, number of cases, and the way that that's calculated is that you add up the number of cases for a 14-day period. You take that number and you divide by approximately 7.2 to account for the numbers of hundreds of thousands of people that are in Denver. So it's a cumulative case rate per 100,000. So again, you add up the numbers, divide by roughly 7.2, and that gives us our 2-week cumulative case rate per 100,000. That's one of the main drivers, but it's not the only driver because, a number of weeks ago, we were over 175 cumulative case rate, and yet the state did not move us to the phase that we're in now because they saw that at that time, hospitalizations were still stable and positivity rate was still under 5 and stable. What's different now is that cumulative case rate is going up. And but again, that in itself does not mean that we move to safer at home or stay at home order rather, because the other two metrics are not quite there yet. If they continue to track in that direction, then the state could place Denver into that harshest phase. But we're doing everything that we can to avoid that. The state's been very collaborative with us, trying to implement strategies to avoid that. But as I said earlier, this virus spreads so easily that we're seeing municipalities throughout the state and throughout the country that are having to move to more restrictive measures. It's my understanding as of a couple of days ago, there were some 30 municipalities that had they just strictly enforced the metrics on the dial, they would have been in a different phase a number of weeks ago. So I think the state's been collaborative. They're going to continue to look at those three metrics. But if case rates were high and hospitalizations were still stable, then perhaps we wouldn't have to move to a more restrictive level. But the problem is that they're all three trending in the wrong direction. There's no hard and fast rule on this. We look at all of those things and much more, and we'll work closely with the state on the decision making.
Thank you. So one other question, at Palco Central Park, it doesn't allow a lot of queuing. So if you drive, I don't know if you've been over there recently, but there's times where the cars are queued way out onto the street, and really far back, which is okay because it means people are getting tested, right? But to other people's points, Councilwoman Kenichis and Councilman Cashman, if we can have other testing sites, I know it's resources and I know it's a lot of work, but there are different areas where they have more bigger parking lots. And I know that we wanted to stay in West Denver, and I absolutely support that. But just making sure that we are keeping the right-of-way safe. I think one time I heard it was 5 blocks long back the queuing, so that meant and there's a rail line there. So it just wanted to bring that to your attention. And one last question: how are we doing on getting testing results back? Because I know there was a time period where it was 7 to 10 days. And I think right now it's almost back to 7 days, which is a very long time for somebody to go. I know somebody who went last week and they still haven't gotten their test results back. And that's a long time to not, when they had been around someone who was COVID positive.
Correct.
It people start losing faith and they start going out and about. So how are we doing on making sure that we keep as much testing as possible, but we also make sure that we get our test results back in a timely fashion?
Yeah, thank you for the question, Councilwoman. There's a lot there. I'll try to respond to everything that I've heard. The testing response times do fluctuate based on the number of things. I think on our part in DDPHE, we are, to my earlier point, we're taking all of those samples, getting them into FedEx that day, getting them mailed out to the lab, to the state's lab and contractors that we might use. Their response times vary dependent upon, what their resources are and how many tests they're getting. But I last heard, I believe it was yesterday, that what we're turning in is still, and the results that we're getting are 2 to 3 days, which is still, given the spike that we're seeing, still pretty decent. Of course, the quicker the better, but there are many things that are outside of our control. In fact, I heard yesterday the state might be making some changes to how they're going to handle community-based samples and that sort of thing. We're going to keep adjusting based on multiple factors that are outside of our control. But right now, I think we're doing pretty good. I do want to remind everybody who might be listening in that I hear this from time to time, that people will call in and they say they haven't received their results yet. If the result is positive, they will get an email on that. So so they need to check email first, and not just email, but check the spam folder too, because it could be sitting there. But we have people that are answering phones all day, every day, multiple people trying to get that information out. And those are the calls that we're getting sometimes, is that people say, well, I haven't gotten mine yet. Where is it? And then we tell them, well, check your email, and well, there it is. So I just remind everybody to do that. Remember that there will be an email and a call, actually, if you're positive. So we'll keep an eye on that and do everything we can to get those results back as soon as possible.
Just to repeat what you said, if you are positive, you will receive a phone call, and it's that phone call to help with contact tracing so that people can ask where they've been, and then we implement contact tracers. Like you said, to your point, we have trained several contact tracers, hundreds of them, and now we probably need them now higher, because we have the spike higher now than in the stay-at-home order. So is that what the phone call is for? Just so the public who's listening, that's what they would be expected to ask, or what does that phone call look like?
Yeah, slightly different process there. So people who are positive are going to get a call that they were positive. People who are, and then they'll get guidance on what they should do with quarantining and when that would be over and that sort of thing. Contact tracers are calling everybody else. So during the case management process, a person will be notified that they're positive. Our partners at Denver Public Health, and we have some staff doing this here too, who will call the cases, talk to them about where they've been, who they've been in contact with. We collect that information. We would try to get of course, the name, the email address, phone number, everything we can so that we can then that gets turned over to contact tracers. And our staff members do a great job with, they don't just call. Because people don't want to answer their phones these days if they don't know who it is. I've asked them to call, send a text message. People will look at text messages before they'll answer the phone. And so we'll send a text message out saying, this is who we are. You might have been exposed, that sort
Not
of
just
thing.
millennials.
And then we'll email. And so we're trying to get all of this information out, but you're talking about two slightly different processes there. Different people call to inform cases if they're positive, and then case managers and contact tracers take it from there.
Okay, thank you, Madam President.
Thank you, Councilwoman. Councilman Flynn?
Thank you, Madam President. Bob, I was befuddled when you were responding to Councilman Cashman about the map.
Were you befuddled?
Slide 8. And I don't know if it's possible to bring it up again or useful, but it's such a very limited data
Or were you
point,
worshiping
and it
Satan?
seems to me that it includes data from before Paco Sanchez and Montbello were opened up. It says it's only 2 months of data, May 22nd to July 21st.
Maybe sacrificing
So,
a goat
August, September, October.
in your backyard?
There's 3
I
months
don't know.
additional since the end of
In
the
a
end
non-Santeria
point of
sort of
data
way,
on
and more
this
like in
map.
the
I
ready
think I
or
heard you
not
say that it
movie sort of
represented,
way.
the number of people from each census block tested at either Paco Sanchez or Montbello, but this only shows the Pepsi Center site. I'm very concerned, of course, because it shows my district being very, very, very red. And I know
Your
that
district
I sponsored a site
red? No.
at All Saints Church. We had Lincoln High School lined up, and now we have Paco Sanchez. So the colors should be much more yellow and green in the west and southwest. Is there a way to get it? First of all, am I reading that correctly?
I want to make sure I'm on the right slide. I'm looking at slide 8.
Yes.
And again, as I understand it from our data folks, this includes, this is where people live that have been tested at those sites. It's not that there hasn't been testing. There's other community, and to your point, you've had events in your district where that might not be included here because it wasn't a part of Pepsi Center or Paco Sanchez Park or what have you.
Okay, was Paco Sanchez testing site opened and Montbello opened before July 21st?
No, I don't believe so.
Okay, because that's what this data says it's from. So I think maybe this is the wrong map for what you were talking about.
Well,
I find it impossible that people from East Denver and down in Rosedale and Welsher were driving up to Paco Sanchez Park to get a test.
well,
But people in Harvey Park were not.
But again, Pepsi Center is on here. So even though this is from the time of the Pepsi Center, and then added to that was Paco Sanchez Park in Montbello. So you might look at this and think, well, wait a minute. I know that those last two sites were not set up at that time, but the Pepsi Center was.
Correct.
So it's possible that that they went to the Pepsi Center.
Okay.
But
Now, does the data then also include? First of all, I find the scale very confusing too. It goes the lowest is 1.49% of population, and then it jumps in sort of irrational leaps, and the final one being 9.98 all the way up to 22%. So it'd be nice to have more of an even.
Bitch, that's how data works.
On the different levels that you're trying to show here.
Oh
Does
my
it include people who
God.
have been tested multiple times?
Yeah, I'm not sure about that, Councilman. Again, I just saw these maps this morning.
Okay.
I want to be clear. It's not that they were just shared with me this morning. I got them a couple of days ago, but I wasn't able to look at them. I saw them this morning, and that's why I wanted to add them at the last minute to today's conversation. But I recognize that, again, there may be some more markers on here. I think the data folks have done a great job, but when people like us who might not, well, at least like me, who might not understand how the maps were put together, but we're not behind the scenes, it might be a little confusing. I had mentioned earlier, I'd like to see some more markers, so that we know exactly where the locations are. We can certainly take a look at districts and that sort of thing. But I made a note here to take a look at the scale here.
Don't blame him because you don't
Not only that, but I guess
understand
you have
basic
3 months of additional
statistics.
testing.
Then maybe you shouldn't be
and
looking at data.
significantly
You shouldn't be
more testing
questioning.
since July 21st,
Ugh!
which is
Do a Google search.
Date on this. And then finally, when my wife and I were tested,
Oh my God, you're what? Oh my God.
That one. We didn't give our addresses. We just gave our phone numbers. So do we always? So we wouldn't show up. My wife and I wouldn't show up anywhere on here as having been tested because you don't know where my phone number is.
Well, that's right.
Do we collect addresses now? Is that a standard thing that we collect addresses?
No, well, again, this are for the 3 sites that we've been talking about. It sounds like you were tested someplace else, and wherever you were tested, might have different protocols for that. Perhaps they collected your address, perhaps they didn't. We're only doing a portion of the testing in Denver. Healthcare providers and private sector companies who provide testing, they might have different protocols.
This was Denver Health.
Oh, okay. Yeah. So I'm sorry. Your question was.
Are we collecting addresses now? My wife and I think in August.
Do we need to?
DDPHE does not collect addresses. There are some concerns about that.
Right.
We want to be as open and accessible as possible. We don't want people to get concerned about collecting too much information because then they won't show up. I can't say that everybody's doing that, but that's been the position that we've taken, is that we want it as open and as accessible as possible.
Okay, so then it's possible that when the map shows some deep red areas, that more people might have been tested who live there, but we just didn't get their addresses.
Well, yes, that's exactly right. There's a lot more testing that's going on outside of what's represented here, including our own testing on outbreak investigations in a wide range of businesses. That is not on here. I'm just talking about the fixed sites and how does Paco Sanchez Park and Montbello look in comparison to Pepsi Center.
Okay, thank you. That's all, Madam President.
Thank you, Councilman. Councilwoman Saida-Baca.
Thank you, Madam President. Can you hear me?
Go ahead.
My question is kind of related to a couple of the questions that have been asked. Help me understand, Mr. McDonald, what the consistent testing is in Central or Northeast Denver. We use the online site to communicate with our constituents what's happening. And you mentioned that Denver East has consistent testing, but we only see on the website that they test at the end of the month. And then Inner City Health has a day and Clinica has a day, but there's no consistent testing in District 9. Can you help me understand what it is in District 9?
Well, yes. I mean, I think one of the questions earlier is, can we get a breakdown on the testing done by district? I don't have that in front of me, Councilwoman. I'll do everything.
No, locations. I'm asking about locations because you mentioned that the website is wrong, and that's our primary source of information.
Okay. Well, I have to again take a look at the website. I'll look at that. There seems to be a bit of a disconnect between what I'm hearing from our staff and what at least today is on the website. So I'll go back and take a look at that. In terms of static sites, I think is what you're asking about. I don't know where all the static sites are outside of what DDPHE is providing. I know that we have done events in many different, when I say community testing event, I mean that we've gone into many of your districts and set up a
they're fixing
and
updating our home security system
to all of your constituents.
But you mentioned earlier that
live streams,
DHS
the lights
East was a static
got full
site.
setup now.
Yes, I believe that that Denver Public Health is looking at using that site, and we are too.
So we would like a static site, but if it already is, we didn't know, and the website's not showing that. So hopeful that we'll get some correction, but ASAP. The second question is related to Councilman Hines' question about consistency for businesses. We've gotten a lot of questions as well about inconsistency in the limitations. There are people who are frustrated that they have limitations on their business, but that you can sit in a restaurant with many more people until midnight for some beers. And so where is there some rubric or some standardized piece of information that tells us why certain businesses are allowed to stay open and others are not?
Yeah, it's an excellent question. I don't know that we're ever going to be able to come up with a rubric because the challenge with this virus is that we're seeing many different venues that will have outbreaks, and then we put controls in place there, and then we no longer see outbreaks, and then we see an outbreak over here. The outbreaks seem to be moving around. There's no rubric.
You're fine.
The best place to look in terms of what are the restrictions given the various levels that we're at with the 3 metrics I spoke of. It's best to look at the state's dial for that. That's where you see, what every business has to do. In this recent round of public health orders, that was actually implemented by the state. The state took that action on Denver, and I respect their decision to do that. I think to the extent that we can get at scenarios where there is more local control and tailoring of public health orders, and I think the state's been great with trying to move in that direction as much as possible, but with the wholesale just a widespread uptick of cases across the region, they felt it was necessary to implement all the restrictions in level 3. Again, I respect their decision, but that would be the best place to look at in terms of what are the restrictions for every type of business or venue, given what caseload we're seeing in Denver.
I appreciate that, and I'm still very concerned about Denver not having or not appearing to be taking any leadership here, even with protocols across the city. You mentioned earlier that you don't necessarily know who's collecting addresses, who's not, who's doing X, Y, and Z. And that to me is concerning coming from, the head of an entity that should be leading how we're collecting information, what information we're collecting, what protocols we're following.
I love you
my
so much,
hope,
Candy.
Is that we'll ramp up our leadership here and make sure that we're setting the tone for how we're doing it across the entire city and what is expected from other testing sites so that we can better target our efforts and better understand our efforts. That's it for my questions, Council President. Thank you.
Could I just add some response to that, just some clarity? I appreciate your comments and your concerns, Councilwoman, but they certainly don't seem to align with the feedback that I've received from the State Health Department in terms of the city of Denver and this department and everybody that we're working with taking leadership on this role. I might remind you that the city of Denver was the first municipality in the state to issue a stay-at-home order. The city of Denver was the first municipality in the state to issue a face covering order. The city of Denver.
Just because we're doing better than the rest of the country doesn't mean we're doing well.
Most requirements in terms of face coverings.
Choose your benchmark carefully. This is why data collection and analysis matters.
Complementary of our efforts. When you get into the details about what private sector businesses are doing in terms of testing and what their protocols are, I don't know if there is a public health director in the country that would have that information at their fingertips. I'm not saying that we're not collecting that information. In fact,
but you're not saying that you are.
500 tests are being done.
Right, Kay?
Across
it's pretty low bar.
Those are not all ours. But to know what their protocols and what their timeframes are, and I think that would be very difficult to collect all that information. If there's something specific that you would like to know about a particular venue, happy to partner with you on that to get that information to you or any other council members. But it would be very challenging for me to know the details of every private sector business or venue that is doing testing. But we'll collect what we can for you.
No, it's all good.
We'll gladly send them your way. Thank you.
No problem.
Thank you.
All right. Thank you, Bob, and thank you, Councilwoman Seda Baca. Councilman Hines, we have you back up in the queue.
Get him,
Thank you,
Hines.
Madam President. And just, I guess to follow up from Councilmember Seda Baca's question about restaurants and different industries. Again, I think that Denver's doing great. I prefer a safety first approach. Our businesses are struggling for sure. I want people to stay alive. So I'm not disputing our approach. I wonder if there's so for some reason we have like restaurants as an example with certain criteria, and then so not by individual locations but by industry or vertical. I wonder if there's data around how that determination was made. Like, is there data that says restaurants that have opened their parking lot and they have tables outdoors that limits COVID spread, and gyms indoors don't? I'm trying to understand, because I go by, District 10 has a lot of restaurants and we have a lot of people outside, and no one's wearing masks because you can't eat or drink with a mask on, right? And so I'm assuming we made some sort of evidence-based decision.
Heinz, you might want to spend some time with trail
and
runners. They can do anything without removing their neck gaiter. It's kind of amazing.
Yeah, absolutely. Great question. And it's probably one of the questions I get the most. What are all the things that you look at to make the decisions that are made? Certainly data has to drive this, and public health has to drive this, not the economy, and public health comes first. But we don't just look at data, because there are some limitations with that. The more you see community spread, the more you're going to get as part of the case.
That's why I was hammering Candy yesterday. The more data you see, the more data you become aware that you aren't able to collect, and the more you should be tweaking your model as you go.
The harder it is to target that. It's the very reason that we don't look at.
If you're not targeting and have some framework to guess how much you may be missing or failing to capture, then
all of that into account.
You need to go home.
I think the challenge here is, at this point in time anyways, is that we're not able to target it as much as we were before. And let me share what I mean by that. It was very early on during this pandemic. It was really easy to tell that long-term care facilities, that's where the challenges are, and we focus our efforts there. And most recently, when we saw outbreaks from post-secondary settings, we targeted our orders towards post-secondary settings. When we can see where there are outbreaks of non-compliance and we can target the orders, we want to do that, because that we know that with every order that's issued, there's a behavioral health component to that. That there are just impacts from those. So we want to stay as targeted as we can. When we see a lot of community-wide transmission and a lot of just people not distancing themselves, the data becomes a little bit more gray. And so that's why we look at all of those things. We're going to keep doing that. Look at data, look at where we're seeing non-compliance, take a lot of things into account so that we can target these as best we can. Now, there might have been something in there, Councilman, that you had mentioned that I didn't address, and so I apologize if there was something there. Please ask again, and I'll try to address it.
Thank you, Director McDonald. I mean, in some ways, I'm kind of asking you to pull a rabbit out of a hat, as in, like, how do we, higher education institutions and senior centers or assisted living facilities, they are easy to place on a map. Restaurants are all over the city, and so it's hard to say, well, this was the restaurant, not the gym immediately next door or the salon immediately next door. But I figured I'd ask in case you knew something that I didn't. I guess that you are the expert after all. So I didn't expect a particular answer, but if I don't ask, I definitely won't get an answer.
Yeah, no, it's a great question, and not to belabor the point, but it's an excellent question. We need to look at data. Sometimes it's clear the data is more clear than others, coupled with looking at where outbreaks coming from, because those outbreaks are, they're certainly contributing to the data, right? But when we're seeing kind of outbreaks in multiple venues and the data isn't quite as targeted because of more community transmission, more widespread transmission, it's a little harder to get at that. But every step of the way, we're going to continue to try to focus on, what are we seeing with the data? What are we seeing with non-compliance? What are we seeing with outbreaks? Where are we seeing outbreaks? We're going to look at all of that and try to make as some really targeted decisions to manage the impacts of our public health orders.
Thank you, Madam President.
Thank you, Councilman. Councilwoman Kniech. Oh,
You're muted.
mute.
Thank you. So this is a very sobering conversation and the business impacts are heartbreaking, but I do appreciate my colleagues who've raised the questions on data. Bob and I have had a long back and forth on this. And I think just two things I want to highlight. One is I've heard from restaurants who have tried to use the absence of outbreak data at their restaurants as proof that there's not spread happening there. And I just think that, those are apples and oranges.
Mm-hmm.
Outbreaks are
You're
reported
right.
where there's residents of a facility or employees who return regularly to a location. I don't know that there is a way, community spread, as you've described, Bob, among, let's say, a table of 5 people who spent 2 hours together and then, aren't able to pinpoint that it was that restaurant that they ate at. There's a difference between an outbreak that requires reporting where people who return to a location every day now, like a workplace or a care facility where they live. And so I just want to be clear, the CDC data very clearly indicates that people who tested positive were twice as likely to have been at a restaurant than those who did not. And so I think there is, I don't think it's, you described language before, safer versus safe. And I think that we've had the discussion today about the fact that you are not wearing a mask while you are eating indoors at a restaurant. You are less safe than if you are outdoors or wearing a mask or not eating in proximity to other people. And I just think that for us to, the fact that there are not outbreaks announced at restaurants does not mean that community spread is not occurring there. So I just think that's a really important distinction. And I understand why the businesses are advocating for themselves, because they're fighting for their economic survival. But, I just think the absence of an outbreak means you don't have employees who are sick. It doesn't mean
Correct.
that spread hasn't occurred.
Correct.
The other thing I just want to share is that,
I'll give credit when it's due, y'all.
I know our communications, and I'm about to send out an email, and it says this, that the next step is stay at home. And that is true on the state's dial. But Bob, correct me if I'm wrong. We actually could take more stringent measures. We have facilities, for example, that are under state waiver right now that we could decide should no longer be operating. Or we could, when we did this in March, we did close bars and restaurants first before we went to full stay at home. So I want to clarify with you that you are continuing to evaluate all of the full range of interim options, not just stay at home or nothing else. Because I think the colleagues who asked questions before me brought up really, and again, none of this is easy. This is heartbreaking, but I will just be a pragmatist. We followed Europe to a T in the spring, to a T. And I can see what's happening in Europe now, right? It's very clear. I don't know that we can change the trajectory. I believe people can, for themselves, keep themselves safe. They can do all these things. But if we continue to have people eating for hours together with no masks on, if we have gatherings of still 100 people in some indoor facilities being legal, those are not things Europe's doing right now. And so I think, for me, I see that these things
So
are going
now we look
come
to
an
Europe?
end. And the question is,
Now
do they
Europe's
come
the
to an end all
standard,
at once?
really?
Do they come to an end in phases? And so I just, I guess, very sobering way to end, but just confirming that you will take and you are considering other interim measures to try to prevent that final action. And we won't wait for the state to tell us, I guess, is the other thing I'm looking for. I'm looking for reassurance that this is not just the state, that you indeed, like we did in the spring, will lead where you feel like we need to be more assertive.
Yeah, thank you, Councilwoman. I don't think there's anything you said there that I would disagree with. Certainly, to your early point about there, you can have a difference between outbreak and just community spread. And how do you target that? I don't disagree with you on that. It's a valid point. That's why we look at everything, not just data or outbreaks. We look at everything, and I also take into account not just the data and where outbreaks, but what are our compliance teams when they're out checking for compliance? What are they seeing out there? All of that is taken into account in terms of next steps. And, you know, I want to go back to what I said earlier, that we're going to continue to put public health first. I think we demonstrated that very early on with our stay-at-home orders, with our face covering orders. You know, people don't want to wear them, so they're not going to be able to get into restaurants or what have you. We've jumped out in front with public health first, I believe, every step of the way. Now, even Dr. Fauci has said recently that, you know, with harsh economic impacts, you can run into more public health problems down the road. I don't know that any of us would disagree with that. So certainly, is that on the back of my mind? Absolutely. But public health comes first. That being said, we know that if there's more unemployment, more businesses go under, people can't pay their rent, they can't pay for their housing, they can't pay for food for their families or utilities. Well, now we have more public health problems. But that is not what drives the decision. Public health comes first, and we're going to continue to try to strike the right balance every step of the way. I also want to share with you, and I'm not saying this because I just got the question, but I was talking with Dr. Berman and our partners at Denver Public Health this morning. And when we opened up the call, the first thing I said is we need to start talking about next steps before we just go to stay at home. We need to be in front of this. I don't want to just go to a stay at home or from here. We need to think about, you know, what are the next steps? And some of those things that we were considering are, you know, what about athletic programming? Do we have to do that right now? We're seeing some outbreaks from athletic programs. So there are things that we can do before we get to a stay at home order. I agree with you. It does not have to be feast or famine, and we shouldn't take that approach. You know, we're not going to wait, but we're going to continue to do what we feel is right. Sometimes the state might feel that they need to take quicker action. Sometimes we might feel that we need to, but we're going to keep working closely with them to take a balanced approach.
Wonderful. Well, thank you, Bob, and thank you, Councilwoman, for that question. And this is very sobering, and it's been a great conversation. And I had a few questions that I'm just going to throw out there to you, Bob, and hopefully we can get follow-up answers to them. But it would be really helpful for my council office. You know, I live in the Montbello community and represent the far Northeast. 80% of the Montbello community and Green Valley Ranch. And unfortunately, my council office, we weren't communicated with at all around the stand-up of the Montbello Recreation Center testing site. And so if we can shore up those communication lines, we stand here ready to help get that information out. I have a staff member on my team who can translate immediately. We're members of at least 10 or 12 different closed Facebook sites. I think 7 or 8 of them are Spanish speaking only. And, you know, the numbers of Latinx folks who are being affected, that's the highest demographic group that are affected negatively by this. And so where we can partner better, and you know, I know you have an individual who manages this, but maybe there can be better coordination as well with the website and where you're even tagging the council office's Facebook page, tagging us so that we know when you're rolling something out. Ideally, we would get a communication and have that collaboration before it gets rolled out, but I want to be sensitive that you're trying to do your job and we are in a public health crisis with a pandemic. So you need to move quickly, but please include the council office in on that. And then I would love to, a data point, get the daily numbers that are being tested at the Montbello site, because we have a lot of ties out there. And if we want to get more people out there, we have mechanisms within the community to drive that number up around folks getting tested. And then my last question, which I know you're not going to have time to answer any of these, so I'm just kind of throwing them out there, are what's going to happen to these testing sites when we have our weather in Colorado, bitter cold, snow, and how are we going to keep these going if we have a weak cold snap and then we can't do any testing, what are people supposed to do? And so those were some of my overarching questions, and I know we're right at time, and so I'll let you have at least the close on that, and we'll get those follow-up answers from you. And again, thank you for all the work, Bob, that you and your team are doing.
Well, thank you, Councilwoman. I just want to say that I have a lengthy list here, and so if you don't hear from me in the next a week or two, please reach out and remind me if something has escaped me in trying to capture everything. I know that you would all like to see perhaps a breakdown by districts in terms of what testing's been done. We'll have to collaborate on that with a lot of external partners, because a lot of it is done not by us. There'll be some challenges with trying to pull some of this together, but we'll do the best we can. We do have a plan working to implement for weather. It's one of the things that we take into account. Is there a place where the staff that are out there can stay warm? What does the flow of traffic look like if there's a lot of snow? We're looking at all those things out of our Department Operations Center. Before I end, I just want to share one other thing with you that we've been working towards. We haven't been able to reach out to communicate with you yet, but it stems from a meeting that I've had with a couple of you regarding how do we overcome the communication barrier in underserved communities, or communities where there's a high percentage of people of color, and overcome perhaps some of the challenges with those communications and perhaps even trust at times. And so we were thinking about maybe doing some of our messaging, perhaps me with every one of you, where we would do some videos and message together, me with all of you for your districts, and push those videos out. Because then they would see, someone from the public health department with their council member. And so we're working on maybe doing that type of marketing approach, partnering along those lines. And so we have a member of the mayor's office and marketing working with my communications director and deputy director. And so watch for that. We'll be reaching out soon to see if you'd like to partner with us on some of that messaging.
All right. Well, thank you, Bob. We appreciate it. And as always, we all stand ready to help and support you in getting these messages out. And if there's follow-up questions around data points, please don't hesitate to reach out to us, and appreciate my colleagues for staying on with us. And thank you again, Bob, for all your work. And everybody, remember to wear your masks, stay physically distanced, and wash your hands, and limit your movement. We need to create a little bit more structure around how we're doing that, and we'll all try to do our part. So thank you again, Bob.
Thank you all. Right. Take care of yourselves. We'll talk soon.
All right. Thank you, everybody. We are adjourned. Have a great rest of your day.
Okay. Well, we also need structure to help the unhoused, because really all of this that we're doing, we're not doing. We also need to look, using the same praxis that I was discussing, the same frameworks. We also have to evaluate what we're not doing. So one of the biggest violations that we're committing on a weekly basis is at the behest of Mayor Hancock, which is sweep after sweep after sweep, because he's trying to make his developer buddies happy. Okay. Now, Denver City Council has more power than they think they do. They do not have the power to, say, Mayor Hancock, stop, and make him do that today. But what they can do is communicate our anger, and we have to do that by communicating it over and over and over again. Hancock might be a little bit checked out because this is his last term. It ends in 2023. But I like to think of it as, you're stuck with me till 2023. You're stuck with you till 2023. And we ain't going nowhere either. So what you gonna do? This is where direct action comes in, right? You've got to be asking inside City Hall if you're going to protest outside City Hall, right? You need both. Not saying one is more important than the other, and I never will. I'm not trying to protest police, not my place. What I am saying is anyone who is not comfortable in block but wants to do something, come out, join me. I'm going to be talking to Wall Moms later today about implementing some ideas that I've been having. And that just goes straight to what moms do. Shame. Want to shame the shit out of everybody involved in this, everybody who's been complacent, everyone who's turned a blind eye. And mutual aid is not charity. You do something you do once and feel good about yourself. It is an ongoing care and concern that we show for our community members. It's not a one-time thing. There are a lot of mutual aid organizations. Well, I use the word organization loosely. A lot of comrades that are doing really great work in our communities, like Sick, Tired, Dead, Feed Your Hood. Sorry, that's the same account. Sick, Tired, Dead, Friends of the Forsaken, Cajun Calming. If you have not donated to these individuals, please do. I want to start, hopefully I'll be able to say we want to start something a little bit bigger. I want to get people back at city council on Monday nights. I mean, yes, I understand there's a second wave coming. I do. But that is a big old room, y'all. And that is a gigantic GD building. So why not show up and say, bring all the stuff that you have lying around that you would like to give to the unhoused. Maybe we bring some can openers and sit down in the nice warm lobby and just take the lids off the cans while we make the things to distribute to the unhoused to keep them warm. The more people we have showing up doing these, craftivism projects, and I ain't a crafty bitch at all, that's going to be some powerful visuals for not just the media. BuzzFeed, when you love to see that, like a whole bunch of moms and dads and kids sitting around making things to help the homeless in a very public way, while reminding the mayor and city council that we wouldn't be doing this if it wasn't needed, that they are responsible for the gap that exists. And they're wasting the investment we make in our community, which is our tax dollars, on sweeps during a pandemic, which make us sicker and are a bigger health risk than actually containing the problem. So they're putting us at risk while we help those who are at most at risk. I think that's gross. Hopefully you do too. Either way, protest mom. I gotta go do some legit work for a few minutes anyway before I come back and curse some more. Have a good one.